Welcome to the Pediatric Advanced Life Support chapter on cardiac arrest in children. Cardiopulmonary arrest or cardiac arrest occurs because of abnormalities of the heart and causes the heart to stop beating and the blood circulation to halt. However, cardiac arrest cases among children are low. The most common cause of cardiac arrest in children is prolonged respiratory distress, failure, or shock. Children with primary cardiac arrhythmias that lead to cardiac arrest have very low survival rates. Because of this, it is critical to quickly recognize any signs of cardiac arrest in children and provide the appropriate treatment. There are two main types of cardiac arrest that present in children: hypoxic or asphyxia arrest and sudden cardiac arrest. Asphyxia arrest is the most common cause of cardiac arrest in children, and it happens when there is a lack of oxygen in the body as a result from complications in breathing caused by respiratory failure, shock, and cardiopulmonary failure. Sudden cardiac arrest, however, is not common in children. It is identified by the absence of cardiac and respiratory function or by the arrest rhythm on the cardiac monitor. There are different problems that may cause cardiac arrest, including hypertrophic cardiomyopathy, anomaly of the coronary artery, long QT syndrome, myocarditis, drug toxicity, or trauma to the chest. There are four primary types of cardiac arrest rhythms in children that we will look at in this video. Asystole, or flatline, is the first type of rhythm seen in pediatric cardiac arrest. This is the most serious type of cardiac arrest and is almost always irreversible. Asystole is associated with no cardiac electrical activity, meaning no contraction of the cardiac muscle and therefore no cardiac output or blood flow to the body. When this type of rhythm presents, the first step is to ensure that you're dealing with true asystole rather than an error reading due to improper lead connection or no power in the unit. Some causes of asystole may be hypothermia, sepsis, poisoning and drowning, or prolonged submersion. The signs of asystole include no patient response, no breathing, no pulse, and a flat line on the ECG. The next cardiac arrest rhythm is ventricular fibrillation, known as VF, which is an arrhythmia that can cause sudden cardiac arrest. In VF, there is disorganized electrical activity in the heart and fast, erratic heartbeats, causing the heart to stop pumping blood to the rest of the body. VF is common in children and may have many causes, including congenital heart disease, poisoning, electrical or lightning shock, drowning accidents, trauma, or drug toxicity. VF does not have an identifiable ECG waveform, as the heartbeats are erratic. Early waveforms show a coarse VF, but after a few minutes, the waveforms become much smaller and show a fine VF. Another rhythm seen in cardiac arrest in children is ventricular tachycardia, known as VTAC or VT. This is a fast and abnormal heart rhythm that originates in the ventricles of the heart. VT can lead to VF and cause sudden death. A pulseless VT arises when there is no cardiac output, then resulting in no pulse and cardiac arrest. The causes of pulseless VT are myocarditis, electrolyte abnormalities, cardiomyopathy, myocardial infarction, trauma, and drug toxicity. The last cardiac arrest rhythm in children is pulseless electrical activity, or PEA. This is defined by the lack of a palpable pulse or cardiac contraction, even with the presence of organized cardiac electrical activity. PEA presents with prolonged PR and QT intervals, complete heart block, or AV dissociation, which is when the atrial and ventricular activation are independent from each other. PEA can be caused by different factors, many of which are represented by the reversible causes known as the 5 H's and 5 T's. The 5 H's are hypovolemia, hypoxia, hydrogen ion increase known as acidosis, hyper or hypokalemia, and hypothermia. The 5 T's are tension pneumothorax, cardiac tamponade, toxins, pulmonary thrombosis, and coronary thrombosis. This concludes our first video on cardiac arrest in children. Please proceed to the next video to learn more.